Hello, this is Mohammad Toosy, your Lean Six Sigma Master Black Belt. Today, I'm going to talk about something really interesting, which is 4 organization capabilities which need to be developed for Lean, especially in the context of hospitals. Interestingly, Lean is a rational and scientific approach. And because it's a scientific and rational approach, hospital employees can readily embrace, as most of them are scientifically trained. If we had respect for people and fully involve them in the improvement rather than relying on a few experts, this should be the case. Now, the first capability which needs to be developed is work is designed as series of ongoing experiments that immediately reveals problems. There are the key elements in this statement. There are 3 key elements. First, work is designed, which means the way we do things is not random, inconsistent, or haphazard. The lean concept of standardized work means that work should be designed by both employees and their leaders rather than allowing common practices to just develop. A director of patient safety at a hospital lamented that it's not always the case in hospitals, saying, "Our blood administration system is complex and it's just sort of evolved on its own. There are many inefficiencies and opportunities for error." Hospital employees need to standardize key processes and tasks for the sake of improving patient safety, preventing time delays, making work easier for employees, and reducing costs. We don't standardize for the sake of standardization. Rather, Lean says we should standardize. When different nurses treat the same patient on different days, having standardized methods helping ensure consistent experience and consistent care for that patient. As a patient is in outpatient cancer treatment setting complained, things work differently every time I come here. For example, some staff allowed late patients to fit in immediately, while others made them wait until there was an open chemotherapy slot available, even if delays were not that patient's fault. This might not have necessarily impacted their clinical care or outcomes, but caused frustration nonetheless and could have harmed patient satisfaction scores. Secondly, standardizing our work does not mean procedures are caved in stone. The lean concept of Kaizen means we have an obligation to find new ways of improving our work. The third element is that we need to structure work in the way that the problems are made readily apparent so that they can be fixed quickly as possible. Simple methods such as visual management gives us tools to make problems apparent. They allow us to tell when needed supplies or equipment are out of place, allowing us to proactively solve and prevent problems. Rather than waiting for supplies, such as blankets, to run out in an unit, simple visual indicators and controls can help us see what's running low. Another is basically problems are addressed immediately through rapid experimentation. In a lean environment, we make problems visible and apparent because we recognize that it is normal to have problems. Therefore, it's acceptable as long as we are working to fix them. The typical mindset is in the automotive industry was that the problems should not be revealed to your boss because they either would get you yelled or at you would receive unwanted attention and management driven solutions that might not help. There is a famous Toyota story about Japanese executives visiting American managers at their newly opened factory in Georgetown, Connecticut. The Japanese executives asked what are the top problems were. The American manager replied, "There are no problems." And the Japanese executive replied, "No problem is a problem." If a manager says no problems, it is likely that the manager is unaware of the problems or is afraid to speak up. When a problem is discovered, the focus is placed on solving the problem immediately. At the place of the problem occurs with an input of the people who are struggling with that problem. There is a lean expression. And there's a lean expression that problems are not solved in conference rooms. Problems are solved at Gemba, the Japanese term for the actual place where work happens. For example, if we're forgetting to send medications home with discharged patients, the team would not just hang signs telling nurse to be careful. Instead, the team might change where the medications are stored so that they are more likely to be seen during the discharge process. The team might also develop a standard checklist form, standardized work for the nurses to follow during each discharge that includes a medication reminder. Another capability. Solutions are disseminated adaptively through collaborative experimentation. Local improvements made in one area need to be shared with the departments of or areas to prevent everyone from having to go through the same improvement cycle on their own. We can view it in teams of our own different inpatient units and floors throughout the hospital. Although we might have differences between specialized units, certain core processes can be standardized, such as how to handle pharmacy orders. When a Kaizen improvement is made in a unit, we need a mechanism for sharing that improvement across units. An adaptive dissemination of different form of traditional rollout of a new best practice that was perhaps developed in one unit. People often complain of being rollovered when they are focused on to take new practice that might not meet the exact need of the unit. Healthcare systems are learning that lean model leads to a more nuisance approach. Instead of each unit of the hospital completely duplicating improvement efforts, the second unit might receive the process that the first unit created, considering that the process to be a starting point for future improvement. The second unit does not force fit the new process without thinking. Rather, it is free to adapt the process as needed for specific patients. If the second unit finds incrementally better ways, it's obliged to share the improvement with the unit which originally developed the new method. Another capability. People at all levels of the organization are taught to become experimentalists. We cannot just throw people into teams without with arming them with skills and methods for effective problem solving. Many hospitals are giving initial lean training, including that for problem solving methods, to all employees of the hospital. Continued coaching, training, and mentoring are required, whether coming from outside consultants, internal process improvement leaders, or direct line management leaders themselves. Just putting a group of employees together to come up with solutions may lead to solutions along the line of what we have already tried in the past, or simply asking people to be more careful or try harder. The lean methodology helps employees see their work and processes through fresh eyes, allowing them to see problems they could not have seen before and to have new ways of solving the problems. Four rules in use for lean. Rule number one. All work shall be highly specified regarding content, sequence, timing, and outcome. Every customer supplied connection must be direct, and there must be unambiguous yes or no way to send requests and receive responses. Pathways for every product and service must be simple and direct. Rule number four. Any improvement must be made in accordance with a scientific method under the guidance of a teacher at the lowest possible level of the organization. And I hope you actually enjoy this and are able to apply it if you're working in a hospital. Thank you.